Okay, let's start lying on our left hand side. Take the time to make yourself comfortable. I would suggest keeping your left leg straight, bending your right knee and placing a couple of pillows or yoga blocks underneath. You may also want to place a pillow or blanket underneath your belly. Rest your head on a pillow. In this short class, I will guide you through some practice contractions. These practices are meant as a guidance only. Every woman labours differently, and the most effective posture or breath you can use during labour is the one that comes instinctively. Trust yourself and your body. You will also find that as your labour progresses, it will be unhelpful to concentrate too much on trying to remember these practices. You will also find that you won't be able to. However, if you practice yoga regularly throughout your pregnancy, you will find that these movements and breaths come to you instinctively. As this practice is in part a visualization, before you begin your practice contractions, I'd like you to create an atmosphere in which to practice which is conducive to childbirth. This may mean turning the lights down a little and making sure that you have everything you will need with you, everything that you are going to use during your labour and birth. Once you are comfortable, close your eyes and come to focus on your breath. Just become aware of your inhale and exhale. We will now move to using golden thread breath. So with your next inhale, breathe in through your nose, and as you exhale, let the breath move out through gently parted lips. Inhale through the nose, exhale through gently parted lips. As the lips are only slightly parted, you will find that this slows down the exhale, so your exhale becomes longer. With every exhale, you feel your body relax. Every exhale is like a cool breeze washing over you, releasing any tension. It is this out breath which will be your pain relief during labour. Keeping this breath going, start to imagine that you are in the very early stages of labour. Again, every woman is different, but common descriptions of the early stages are a pain or sensation similar to period pains or trapped wind. So now imagining that you are feeling these sensations come every 5 to 10 minutes. They last for a few rounds of this golden thread breath, and then they go. During these very early stages, it is really important to rest as much as possible. You may even find that this breath will help you fall to sleep. Now release the golden thread breath and let your breath pattern return to normal. No control over the breath now. It moves freely and naturally. When you are ready to, gently open your eyes. Roll to your left hand side and come up onto all fours. Bring your hands underneath your shoulders and your knees underneath your hips. Spread your fingers brightly. All fours is an excellent position to be in, both throughout your pregnancy and during labour, especially if your baby is posterior or back to back. Many women will naturally adopt this position. Variations of this pose include leaning over a birthing ball or chair, using the support of a birthing partner, and using a wool. If you have weak wrists, you may also want to try this variation with blocks underneath your forearms. Please take the time to make yourself comfortable in any of these positions. Now we're going to start moving our hips in a circular motion. It's as if you are holding a pencil between your thighs and you are drawing a circle. Make the circles as big or as small as yourself and your baby are comfortable with. Now let's take the circles in the opposite direction. Come back to center, pause here and breathe. Many women find this hip circling action comforting during labour. Let's try another similar movement. Stay on all fours and this time rock backwards and forwards. Come back to centre. Now let's rest in child's pose. If your bump is small, you may be able to rest as I am with your forehead on the earth. Or you may need to rest your forehead on your fists or on a block or some blankets. Some women enjoy using a chair to rest their forehead on. The important thing is that you are comfortable. Now close your eyes, take a big breath and relax. Remembering the importance of resting between contractions. Child's pose can make an excellent resting position. Please come back to the all fours position. This time, step your right foot forwards and to the side. This is a slightly different variation of the previous pose. Again, start to circle your hips. And then take it the other way. Finally, try the rocking movements. Take the foot back and rest in child's pose. Inhale, come back to all fours and step the left foot forwards. Again, begin to circle the hips. And then the other way. And now try the rocking movements. Take the left leg back and again rest in child's pose. So in the very early stages of labour, you were able to lie down and breathe through the contractions. As they became a little stronger, you felt that you needed to move, and we explored some of the movements women find comforting at this stage. Now, as your contractions are getting a little stronger, let's put the golden thread breath and the hip movements together. Come to all fours. You can use the hip circles or the rocking, or a combination of both, whatever feels more comfortable for you. Now keep the hip movements and start breathing. In through the nose, out through gently parted lips. In through the nose, out through gently parted lips. Your exhale is like a cool breeze, relaxing your body. Remember, your exhale is your pain relief. Exhale and come and rest in child's pose. As you move into the later stages of labour, when your cervix is moving from 5 to 10 centimetres in dilation, you may begin to start having thoughts such as, "I can't do this." This is normal, and it is a really good time to remember your Sankalpa. If you haven't yet been to a pregnancy yoga class and thought of your own Sankalpa, I'd like you now to think of it. A Sankalpa is a positive affirmation. Repeat this Sankalpa slowly to yourself. Keep repeating it to yourself as you come back to all fours. Again, start making some movements with your hips. Add the golden thread breath and keep repeating this Sankalpa silently to yourself as you do this. Let's take 3 more breaths like this. Exhale and rest again in child's pose. Many women find that they make noises during labour, which they often describe as primordial noises, or noises which come from the pit of their belly. Letting go of your inhibitions and making these noises is most definitely helpful to get through these final stages of labour. There is no way of knowing the noises which will help you during labour. So for today's practice, let's use the sound Om. To be clear, I am using this word only to replace any noises which may naturally come out of your mouth during labour. During this next practice, please make this Om noise loud and let it come from the pit of your belly. The more you commit to these practice contractions now, the more naturally it will come to you when you are doing it for real. Okay, so let's come to all fours. Start to move your hips. And now start to use the golden thread breath. On your next exhale, make the noise Om. Keep going like this, imagining that you have very intense pain in your pelvis. Om. Let's do 2 more. Om. Om. Exhale and rest in child's pose. Remember your Sankalpa. Another contraction is coming, so come back to all fours. As the contraction intensifies, you will need to start moving your hips. Use the golden thread breath. At the peak of the contraction, you may need to make some noise. Om. Om. Take 5 more golden thread breaths, imagining that the contraction is wearing off. Exhale and rest in child's pose. If you need to, stay here, and if you can, move straight into another practice contraction. You feel the contraction coming, so come back onto all fours, and as it intensifies, again you'll need to start moving your hips. Use the golden thread breath. At the peak of the contraction, you may need to make some noise. Om. Om. Take 5 more golden thread breaths, imagining that the contraction is wearing off. Come and rest in child's pose. For our final practice contractions, we are going to imagine that the contraction comes like a wave. For about 20 seconds, the contraction will intensify in strength. It will reach its peak, and then for another 20 seconds it will get less and less strong until you are back to the pain-free baseline. During these contractions, we are going to use the golden thread breath to pull us up the wave. It is as if we were walking up a great mountain. To begin with, we can take long steps or breaths. But as it gets steeper and more painful, the breaths will become shorter, but the breath still pulls us up the mountain. Once we reach the peak, the breath then lengthens as we come back down the other side. When you are in labour for real, you may want to be more active. But today we're going to practice this breath lying down on our left hand side so that we can concentrate on learning this breath. Please take the time to get yourself comfortable. Become aware of your breath and come to any breathing pattern which you find relaxing. This may be your normal, natural breath, or you may find that the golden thread breath is more relaxing. Now imagine that you feel a contraction start. Use the golden thread breath. Long exhale. As the contraction gets stronger, the exhale gets shorter. Until you reach the peak of the contraction. Now you are over the peak, the exhale will lengthen as you come back down the other side. Release the golden thread breath and resume any relaxed breath. We are going to practice this twice more. I will breathe with you, and I will let you know when the contraction starts, when it reaches its peak, and when it finishes. You begin to feel the contractions start. It reaches its peak, and now you come down the other side. The contraction is now over. Rest in between contractions. you feel the contraction starting. The contraction reaches its peak, and you are now coming down the other side of the contraction. The contraction is now over. You have now finished all of your practice contractions. Let's finish this class with the womb breath so that you can connect back with the present moment, with your baby inside of your belly, and enjoy your pregnancy, releasing any fears about childbirth. With your inhale, imagine your breath or your energy moving from your belly to your heart, and with your exhale, imagine the breath or your energy moving from your heart back to your belly and your baby. I'll repeat that. With your inhale, imagine your breath moving from your belly to your heart, and with your exhale, imagine the breath moving back from your heart to your belly and your baby. Knowing that as you nourish your baby with your breath and your blood, not only are you giving them oxygen and all the other nutrients in your blood, but you are also sending them chemical signals about your environment. So just take this time to let your baby know that you love them and that you look forward to meeting them, however you end up birthing your baby. Every breath is nourishing your baby. Stay in this nurturing space as long as you want to. And when you're ready, roll onto your left-hand side, come back to sitting, and gently open your eyes. Congratulations on your pregnancy. May you have a courageous and magical birth. Namaste.